Good evening to our listeners. Tonight we are going to discuss an issue regarding our reproductive health, specifically for women, particularly about menstruation and pregnancy, which I think are two of the most important concerns nowadays. This is very informative and interesting topic since this should not be known to women but also to men. And tonight with me is Dr. Evelyn Lopez, a general practitioner. Good evening, Doctora.
Good evening.
Doctora, for my first question, what is the relationship between menstruation and pregnancy?
Well, if you are pregnant, you stop getting your period. Therefore, yung absence of period mo is the first and foremost sign of pregnancy. Pero it's not always the case. Meron tayong tinatawag na physiologic amenorrhea. Ang amenorrhea, yun yung clinical term for absence of your menstruation. Usually, pwedeng nagko-cause dito aside from the pregnancy, pwede ring early lactation sa mga nagpapa-breastfeed and after the menopause. Tapos, pagka nagkaroon ka ng absence of your period that occurs at any other time, considered na siya as pathologic. Pwede siyang, yung mga causes niya, pwedeng anatomic, constitutional, psychogenic, and endocrine. Bali yung relationship between menstruation and pregnancy, para siyang needle and thread. They're closely linked to each other. That is why when you have a normal menstrual cycle, it is good for the health of the woman, as well as it helps you to have your normal pregnancy.
And Doktora, is it very important po ba sa mga babae to know and understand their cyclic period?
Yes, of course, it is very important to us women to know and understand the cyclic period. Una, kasi we all know that ang menarche, it is the first menstruation. Usually, ang average age nun is between 12 to 13 years old. Ang menarche is a consequence of ovulation. Ano nga bang ovulation? It is the process of development and the release of your eggs or yung ova. And pag nangyari lahat ito sa isang babae, sa isang batang babae, it is when the physiological events of puberty has been completed. Bali, yung menstruation natin usually lasts for 2 to 8 days. And meron siyang interval of 28, yun yung kinoconsider natin as yung regular, to 35 days. Thus, ovulation occurs 14 days before our menses. Irregardless yon of your cycle length. Pagka 28-day cycle ka, ang ovulation mo occurs on the 15th day. While in a 35-day cycle, nag-occur siya on the 22nd day of your cycle. So, dapat talagang malaman natin kung kailan tayo nag-ovulate and yung mga fertile days natin or yung unsafe days. It is usually on the 12th to 15th day from the first day of our last menstrual period. Bali, yung 15th day, yun yung ovulation natin. So, 13, 14, and 15 days, meron ng mga certain changes dun sa cervical mucus natin. Bali, ang nangyayari kasi during our ovulation, yung cervical mucus natin nag-i-increase in quantity. It becomes less viscous. Ibig sabihin, yun yung less sticky siya, or yung wet yung feeling, yun yung tinatawag nating wet, and it is more penetrable by the sperm. So yon, nalaman na natin yung mga dapat nating malaman sa menstrual cycle natin. So ngayon, medyo iintindihin naman natin kung paano nangyayari yung menstruation. So, as we menstruate, nagkakaroon ng sloughing of the endometrium. Ano ba ang endometrium? Yun yung mucous membrane lining ng uterus natin. Nangyayari yon because of the abrupt decrease of the hormones. Yung mga hormones na yun is yung estrogen and progesterone. So, bali sa menstruation natin, meron tayong 4 phases or 4 stages of menstruation. Yung una is yung follicular phase. Ang nangyayari doon, yung primordial follicle natin, kung tawagin is yung primitive follicle, nagde-develop siya into a mature follicle. Tapos, yung susunod na phase is yung ovulation, yun yung 15th day natin. Din yung nangyayari doon, yung cervical mucus natin becomes less viscous nga, penetrable by the sperm. Then, the third phase is yung luteal phase of menstruation. So, bali, itong pag-uusapan natin dito sa luteal phase, ito yung in a non-pregnant woman. Bali, nangyayari dito sa luteal phase, sa early stage niya, nagkakaroon ng increased vascularity of the endometrium. Tapos, nagkakaroon ng formation or development ng corpus luteum. Ano ba ang corpus luteum? Yun yung endocrine body na na-form in the ovary, dun sa site na kung nag-rupture yung mature follicle natin. Tapos, by the end of this phase, yung corpus luteum natin, nagre-regress yun. Kasi nagkakaroon ng decrease ng mga hormones natin, yung estrogen and progesterone. Then, menstruation follows. If ever naman nagkaroon ka ng sexual intercourse on your unsafe days without using any barrier or contraceptive method, fertilization will occur. So, ang nangyayari, during the 15 to 28th day, yun yung luteal phase na sinasabi natin. Yung corpus luteum mo, instead na mag-regress siya, na-maintain siya, so nare-rescue siya. Sino yung nagre-rescue sa kanya para hindi siya mawala? Yun yung hormone natin na present during pregnancy. Yun yung human chorionic gonadotropin hormone. Tapos, yung magiging function ng corpus luteum na ngayon, it will produce increased amounts of estrogen and progesterone to maintain pregnancy and to maintain the endometrium for the fetus.